There's an amazing book called Seeing Like a State. I don't know if you read from the 1990s. It's an amazing book, but it's about how certain schemes, I think the subhead is certain schemes to improve humanity have failed. And it talks about these high modernist, like utopian schemes, um, where there were people who were going to design, like in Brazil, the capital Brasilia, they designed this whole city that was going to be perfect, right? Everyone was going to live in these perfect towers, and they were going to have these big open plazas, and everything was going to be exactly perfect. And the way that they used data to control those systems was built into it. And you start reading this book, and you're like, this is exactly the healthcare system that is trying to happen right now. But of course, it's failing because, like these utopian schemes, that's not how the world works. Humans are imperfect. The ways that people actually interact and engage with each other does not look like big towers of buildings, right? The way that people actually heal and connect is very, very different. So in a weird way, that book has turned me into like a tiny bit of an anarchist right now, which is like an interesting
Right
direction
on.
for me to be going.
Yep.
But I'm very interested in that one specifically because I'm working on a talk right now for an event this summer around perfectionism in medicine in terms of systems perfectionism.
Oh,
And that book, I mean, just literally, like as soon as you read it, like almost to the first paragraph, you're like, this is what they've tried to do to our healthcare system is by making it so, if we just get enough CPTs, enough ICD tons, enough RVUs, like if we just had enough data, we could
wow.
create a perfect healthcare system where
Boy.
nobody ever dies, which you're like, you guys, like everyone's gonna die. Like that's the healthcare system. So
You
like this is
sure?
a fool's errand from the beginning. So yeah, those are two periods that really stand out to me as like major transformations in our healthcare system. And then it feels like we're potentially at the start of another transformative period right now that could be completely chaotic, and maybe there's a whole new depth of terribleness that will unfold in front of us, or maybe not. We don't know, right? Like where we're going next.
That's a really interesting this
Mhm.
because that's sort of where the user's guide to a medical industrial complex is coming from.
Mhm. Mhm.
I trace the history of managed care back to
Mhm.
Kaiser and this idea that if we could Kaiserize the entire health system, which is basically
Mhm.
what Richard Nixon tried to do in the HMO Act, everything would be fine and it'd be just like Brasilia, right? You'd have
Right,
these
right.
vast enterprises dedicated to keeping you healthy. And about every 10 years
Uh,
since the HMO Act of 1973, there's been a technocratic push
right.
that's resulted in consolidation and the creation of these vast, paralyzed, completely insensitive healthcare enterprises
Mhm.
that just dwarf the patient and the
Right.
doctor.
Although I
And
have to say, as a Kaiser patient today, it's not, it's slightly above average. It's
well,
like when I'll
look,
get,
I mean, my parents
yeah,
were Kaiser subscribers. You
yeah,
know, both Halverson, George Halverson was a really
yeah,
close friend. I mean, I've been inside Kaiser,
yeah,
but
yeah.
Kaiser was a one-off. It was a product of a specific moment in time. It was
Rosie the
the
Riveter.
structure
Yeah.
and the incentives that made it work. It was the culture and the clinical leadership. So I
Hmm.
kind of a lot of this book is, I'm sort of
Yeah.
an anarchist too.
Yeah.
When I hear Zeke Emanuel, like going off, when he's like off his meds, I just want to like take him and put him in a room because it's that kind of utopian
Yeah.
BS
Well,
that's
and my thing
created
with
all these
Kaiser
vast
is like,
enterprises.
yeah,
And the most efficient roller up of all, the
yeah,
$400 billion United Health Group,
yeah,
is now coming apart right in
yeah.
front of us. And, so to me, it's like a signal. There are no economies of scale or coordination in this field. And organizations that dwarf the doctor and the patient are eventually going to hit the wall or go off the cliff. I don't know what the right metaphor is, but it's like they're going to run out of legitimacy.
Yeah.
And I think that's where we're at right now, frankly.
Yeah.